The moment you notice your heart beating just a little louder than usual, your body already knows before your mind does. Maybe you're standing in the kitchen, hand on the counter, feeling that quiet inner tension that doesn't hurt but doesn't feel right either. You haven't panicked, you haven't rushed, and yet something inside you is clearly awake. There's a simple reason for that. Blood pressure doesn't rise only because of food, age, or genetics. It rises because your nervous system shifts gears, often silently, often without asking your permission. And the fastest way to influence that system is not force, effort, or control. It's signaling safety. Your body has a built-in brake. It's part of the nervous system that slows things down when it feels secure. The interesting part is that this system listens closely to one thing you're doing right now without thinking about it: how you breathe. When breathing becomes shallow or rushed, even slightly, the body interprets it as alert mode. Blood vessels tighten, the heart pumps a bit harder, pressure follows. But when breathing slows in a specific way, the opposite happens. Signals change, muscles soften, vessels relax. The heart doesn't need to push as hard anymore. There's a breathing pattern that's been studied in labs, clinics, and real people living real lives. Not mystical, not trendy, just physiology. It works by lengthening the exhale just enough to tell the body, "You're safe, you can stand down now." Here's how it looks in practice. You breathe in through your nose for a slow count of 4. Nothing dramatic. Just enough to fill the chest comfortably. Then you let the air leave through the mouth for a count of 6. Longer out than in, like you're fogging up a mirror you're not angry at. That extended exhale is the key. It gently activates the calming side of your nervous system. You repeat that rhythm for about 2 minutes. No holding, no straining, no posture gymnastics, just steady, quiet breathing. Many people notice their shoulders dropping without realizing they were tense. The jaw loosens. The pulse feels less pushy. The body starts cooperating again. This isn't about chasing a perfect number. It's about shifting the internal environment that influences the number. Studies observing this pattern have shown measurable drops in blood pressure during short breathing sessions. Not forever, not magically, but enough to matter in moments when the body needs help settling. And no, you don't have to sit cross-legged or look enlightened while doing it. You can be standing by the sink, sitting in a chair, or waiting for the kettle to boil. Your body doesn't care about aesthetics. It cares about signals. There's something quietly empowering about realizing you don't need to overpower your body to calm it. You just need to speak its language, slowly, gently, preferably without hyperventilating like you're inflating a pool toy in a hurry. If you ever feel that subtle inner pressure building, try giving your breath 2 minutes of attention. Let the exhale do the heavy lifting. And if you want to keep learning simple ways to work with your body instead of against it, stay here with me. Like the video, subscribe, and tell me in the comments when you usually notice your blood pressure creeping up. After a minute or so, something subtle often happens. It's not fireworks, it's more like the room gets a little quieter, even if nothing around you has changed. The body starts behaving as if it finally got the message, not an order, an invitation. Think about how a crowded elevator feels when it suddenly stops on your floor and half the people step out. There's more space, more air, less pressure, without anything dramatic happening. That's similar to what slow breathing does inside the chest. The heart isn't being pushed, it's being allowed. One reason this works so quickly is that the body doesn't wait for logic. You don't have to convince it with explanations. It reacts to rhythm. Long exhale, calm signal. Short exhale, alert signal. That's it. Simple, almost unfairly simple. Some people notice their hands warming slightly. Others feel a soft heaviness in the arms or legs, like when you finally sit down after standing too long. Occasionally, there's a brief wave of emotion that doesn't quite have a name. That's normal. When tension loosens, it sometimes brings little things with it on the way out. If your mind wanders while you're breathing, that's not a mistake. Minds wander the way cats do. You don't drag them back, you just leave the door open. Each time you notice you've drifted, the next exhale brings you back without effort. It can help to imagine the breath like a slow tide pulling back from the shore. Not rushing, not retreating in panic, just returning to where it belongs. The body tends to follow images better than instructions. You might also experiment with where your attention rests. Some people find it soothing to notice the air passing the nostrils. Others feel calmer, placing a hand lightly on the chest or belly, just enough to feel movement. There's no correct option here. The body usually tells you which one feels less demanding. A quick note that surprises many people: trying too hard can raise pressure instead of lowering it. If you catch yourself performing calm, you're not doing it wrong. You're just human. Ease off a little. This isn't a competition. There's no trophy for the calmest inhale. One woman once described it as letting the breath finish its sentence. I love that. We interrupt ourselves so often, even when breathing. With practice, this becomes less of a technique and more of a reflex. Stress shows up, the exhale lengthens automatically. The body learns faster than we think, especially when it's treated kindly. If 2 minutes feels like too much on some days, try 1. If 1 feels like too much, try 3 slow breaths and stop. Even brief moments of signaling safety can soften the system. Calm doesn't have to arrive all at once to be real. And remember, this isn't about controlling blood pressure like a dial. It's about creating conditions where the body doesn't feel the need to push so hard in the first place. That difference matters more than most people realize. We'll keep building on this together. Small shifts, gentle tools, nothing extreme, just ways to make your body feel a little more at home inside itself. There's a quiet kind of confidence that comes from knowing you can help your body settle without arguing with it. Not fixing, not forcing, just responding. When pressure eases this way, it doesn't feel like something was defeated, it feels like something was understood. Over time, these small moments add up. The nervous system remembers patterns the way muscles remember movement. Each calm response makes the next one easier. The body begins to expect safety instead of bracing for impact. And that expectation alone changes how strongly the heart has to work. Some days, you'll notice the difference right away. Other days, you won't feel much at all. Both are okay. Progress isn't a straight line here. It's more like a slow widening of space. Space to breathe, space to think, space to respond instead of react. It can be comforting to remember that blood pressure isn't stubborn. It's responsive. It shifts based on posture, emotion, breath, sleep, and even the way you talk to yourself. The numbers are not judging you. They're reporting conditions. If there's one gentle habit that often helps anchor this practice, it's pairing the breathing with a familiar daily moment. For example, each time you wash your hands, let the water run for a few seconds longer and take 2 slow breaths while feeling the warmth. No timer, no rules. Just a pause that quietly reminds your system to soften. And yes, if you forget sometimes, congratulations, you are officially human. This approach isn't about replacing medical care or pretending stress doesn't exist. It's about giving your body a signal it rarely receives in modern life. You're allowed to slow down now. That signal changes more than we tend to expect. You may start noticing calmer reactions in other moments too. A tense conversation doesn't escalate as fast. A sudden worry doesn't grip as tightly. The breath steps in before the mind has time to spiral. These shifts are subtle, but they're meaningful. And when things feel overwhelming again, as they inevitably will, remember that calm isn't something you lost. It's something you revisit over and over, gently, without keeping score. If this felt grounding in any way, I'm really glad you were here with me. If you'd like more moments like this, simple, honest ways to support your body, consider subscribing and tapping like. And if you feel comfortable, leave a comment about when you plan to try this next. I'd love to meet you there.